Give the patient a mirror and get the patient involved in aesthetic evaluation. Ask the patient if they're happy with the current teeth and their position, and if they want to have any modifications. If they're happy with the look of the existing denture, just want to build back where it was worn, the lab can do it easily. If the patient is not happy with the denture appearance, you can look into more detail. Let the patient relax and smile. Check if the teeth are in the correct position. Is the midline accurate, or does it need to be shifted to the right or to the left by a few millimeters? If there's any discrepancy, a smile picture or a face scan with teeth visible can help identify the issue. Check if the incisal edge is in the correct position. From the frontal view, assess whether the height of incisal edge is accurate using both the patient's relaxed and smile positions. From the profile view, evaluate whether buccolingually the incisal edge is correct in both positions as well. Ensure there's adequate lip support. When the patient is giving F and V sound, the incisal edge of the maxillary anterior teeth should slightly contact the wet-dry line of the lower lip. Clinical pictures from the frontal and profile views or face scan in both relaxed and smiling positions can help determine if the incisal edge is well positioned or needs to be moved up, down, or to the labial or to the lingual. Recheck the occlusal plan to see if it needs to be rotated and if it needs to be moved up or down by the lab. Front and profile smile pictures with and without the Eastern measure in the mouth can show you the occlusal plan very well. Ensure the incisal edge is visible in the pictures. If you perform a face scan, the Eastern measure is not necessary, as the lab can assess the occlusal plan in relation to the face using their software. At rest, the incisal edge of the mandibular incisors should be positioned slightly above or at the level of lower lip line, symmetrically aligned with the lower lip and following the natural curvature. The midlines of maxillary and mandibular teeth should align with the center of the face. The mandibular occlusal plan should correspond to the corners of the mouth, align with the interpupillary line, and all mandibular teeth should have even contact with the maxillary teeth. There should be a consistent 2 mm overjet and 1 to 2 mm overbite for Class 1 patients. If the maxillary teeth are correctly positioned, the lab can align the mandibular teeth accordingly. You can refer to videos for more detail about the ideal maxillary and mandibular teeth positions.